name's Paul Kirkman, and I've got two things for you to take back to Senator McCaskill. The first is we don't live in a democracy, we live in a constitutional republic.
Yes.
Senator McCaskill and I both have something in common. We both at one time took an oath to defend the Constitution. Her oath took her to Washington, my oath took me overseas with a rifle. That my Constitution that I took an oath to, I know that all the powers of the legislative branch of government are confined in Article 1, Section 8, and they have less than 20 enumerated powers. And nowhere in there, as was already touched on earlier, nowhere in there is healthcare mentioned, which is really health control, which is also mentioned. It's not mentioned anywhere in there, so she has no business except fighting against it. I've mentioned this to politicians before, and they take the Constitution and they turn it into some kind of huge elastic document that they try to wrap around everything. If you read our founding fathers, even they said that the General Welfare Clause, which is what she's probably going to try to use to explain this, even the General Welfare Clause, our founding fathers, Thomas Jefferson, James Madison, the father of the Constitution, Benjamin Franklin, and so on, so on, so on. Every one of them said that the General Welfare Clause is only to be used within the confines of the enumerated powers in Article 1, Section 8. Claire McCaskill, I'm not so much looking for an explanation from her as I'm looking for an apology, because this should not even be for
My name is Judy Randazzo. I'm from Franklin County, Missouri. I'm a registered nurse. I've been a registered nurse for almost 40 years. I have several questions for Claire McCaskill. First of all, it's our understanding that the health care reform bill would be paid in part by taking funds from Medicare. I don't understand this at all. We are entering an age where baby boomers are getting ready to retire, and in the next 10 to 15 years, we're going to have more retirees than ever in the history of our country, ever. So why would you want to take money from Medicare in order to fund this bill?
Because they can.
Why did you want to do that? Ask her, why would she want to do that? The next thing I would like to know is, in nursing, I've been an operating room nurse for a very long time, 32 years. I've taught, and the one thing I've taught my students is, don't ever ask somebody to do something unless you're willing to do it yourself. I want to know if President Obama, Nancy Pelosi, Harry Reid, and the rest of the people in Congress and the Senate, are they going to be willing to be on the same plan they're asking us to be on? I'd like to say is, the last thing that I'd like to say is, a number of years ago, probably 8 years ago, I was conned into doing something that was totally against my moral fiber right here in St. Louis at one of the hospitals. I was asked to go in to relieve somebody so they could go home. And I was only told that this woman had been brought in and she was bleeding. We were led to believe that she had a miscarriage. I'm going to tell you the story. Earlier that morning, she had gone across the river to have an abortion. It wasn't a 8-week or 12-week abortion. This woman was 20 weeks pregnant. We were not told about that. Even when we were in the room, we were not told about that. Not until they had all of a sudden said, we're going to have a specimen. This specimen was handed off to the scrub nurse, who almost fainted, and then it was handed to me. It was the decapitated head of a 20-week fetus. Do you know what it looks like? It has hair and eyes and nose and a mouth. What would you like me to label that specimen? If this health care bill passes, they are going to demand that doctors and nurses who do not believe in abortion perform abortions. They're going to force me to do this again. I still have nightmares, lady. And you tell Claire McCaskill I said so.
About whether or not the elected officials would take the same type of plan that would be offered to the general public. I can assure you that Senator McCaskill would not support healthcare reform that she would not be willing to accept.
My name is Terry Kaufman, and I'm a Missouri resident. And I have been hearing a lot about all these people that are not going to be insured if we don't reform health care. And I've been told that there's 46 million Americans who are uninsured. However, I have since found out that out of all these 46 million Americans, 9.7 million are not even citizens of the United States. 16.2 million had an income of more than $50,000 and could therefore afford their own insurance. And 12.7 million were eligible for existing government programs like Medicare and Medicaid and choose not to enroll. That leaves 3% of people who are chronically uninsured. That's quite a bit of difference. And I know that there are people there's some people that have their hard luck cases that they don't have insurance, that really need it. And I know there are some cases like that, and I sympathize with those people, but there's one thing that they need to remember. A government that is big enough to give you everything you want or need is big enough to take everything you have.